But with strikes, there comes consequences, and the consequences can be very, very heavy. First of all, if you're the one partaking in the strike, or if you're the one taking leadership of it, or anything really around that strike, the manager's going to know that you're the one striking. Administration is going to know you're the one striking. So it's almost like you're putting a bad taste in your mouth with your name. Even though you might be striking for a good reason, even though they might understand why you're striking, subconsciously, they already know, hey, you're this person to maybe stir the pot a little bit. You're this person to maybe start things out of unit that maybe they don't agree with. So just by you partaking in it, you're already a little bit more of a difficult nurse, you can say, than the other nurses around you that maybe aren't partaking, aren't maybe saying anything, come and do their job, going home. So you're more of a dangerous one. So they might not tell you anything, they might not say anything, but subconsciously, there's always going to be some thought around it. It's like Big Brother, government kind of stuff. They're always watching. You type in something goofy on a search, and you're in the database, right? You're in the Big Brother database. Guess what? You're also in your manager's database. Mentally, you're also in the hospital's database in that sense as well. So it's kind of a little bit freaky, a little bit dystopian in a sense, but just by you acting out, just by you partaking, you're already put into this separate list. Lots of times nurses can lose their jobs. You're also taking a financial risk. Like I said, you can lose your jobs. You're also not getting paid for the time you're striking. If you have a week-long strike, you're not getting paid for that time. You're losing a paycheck. That could be a lot. Nurses make decent money. A week's paycheck goes a long way, and sometimes it's really hard to make that call of, hey, should I go to work or should I strike? Because financially I need it, but my moral compass is telling me to do it. So then you have a battle within yourself, because there's no reason they're going to pay you by you being outside picketing or you being outside of the workplace and speaking your mind. They're not going to want to pay you a single cent for that. There's just lots of disruption that goes on with a strike, even though they're planned, all that kind of stuff. Lots of disruption, not just from the corporate healthcare hospital manager administration side, but also the nursing side. It disrupts family time, disrupts your workflow, disrupts your family, disrupts your friends, it disrupts your week, your day, your month. It can hold you back from future positions, even though not supposed to do that. Like I said, the whole subconscious thing, it just really disrupts the system. And from chaos usually comes order, but you have to just be able to take on and fight through that chaos if it's something that you really, really believe in. There's also this impact that strikes do play on patients and patient care, even though their strike might be 1 day, 2 day. Remember, healthcare is a 24-hour system. And if you're not there on the unit, most likely they're going to bring in some travel agency or some other nurses that maybe do strikes, that kind of stuff. They're going to bring them on. So there's going to be most likely somebody to fill your role. But you've been on the unit for years, for months, for a super long time. You know the unit better than anybody that they're going to bring on. Because when you bring on a travel nurse or a nurse that does strikes, they're only going to be able to do the basic stuff of nursing. By that, I mean not just like bathing patients, IVs. I'm saying the basics of they're being able to competently give meds, administer things, emergency situations, but that connection and the understanding is what's going to be lacking. That's what I mean by basic. They're going to be able to provide good care, but they're not going to be able to provide excellent care because they don't have that relationship. They don't know the flow of the system. They don't know the ins and outs like you do. So there is that disruption on patient care. But with everything, there's always going to be this side of things. The only way for you to get what you need is if the other side realizes that by not giving you what you need, they're taking a loss. By them losing money, them losing patients, outcomes are dropping. Things like that are what hospitals really focus on. And if you could show up with that by you not being there, by this group of nurses not being there, they're taking a loss just on this 1, 2, 3 days. Imagine that on a monthly scale or a 3-month scale, 6-month scale, quarterly scale, all that kind of stuff. So only way for you to get your side of the argument or for you to reach a compromise with these businesses is by showing them that they need you. Because if they realize that they need you, then you have more bargaining room. You can get more of what you want. Of course, you can't always get everything you want. There has to be some kind of negotiation, some kind of compromise. But they're only going to give you something if they realize that they're losing something.